The promise of a simple walk. It sounds like freedom, doesn't it? The ability to step out your door, take a deep breath, and move without a second thought. But if you're one of the millions who find that gentle walk now comes with a familiar, unwelcome guest, a twinge in the hip, a protest from the knee, or a stiffness in the lower back, then that simple freedom can start to feel like a fading memory. Here's the heart-stopping truth. The pain you feel isn't just because you're walking. It's often because of a few small, key muscles that have become weak or tight muscles that are essential to a stable stride and have been utterly neglected. Hey there, welcome to EverWise Living. Today, we're reclaiming that simple freedom. This isn't about running marathons or grueling gym sessions. It's about 7 simple daily micro moves that act like a natural mobility booster for your joints and armor for your stability. The first move is the Hip-Flexor Kneeling Lunge. The majority of knee and lower back pain during walking actually originates in the hips. Years of sitting, driving, eating, watching TV cause your hip flexors, the muscles at the front of your hips, to become brutally short and tight. This drags your pelvis out of alignment with every step, forcing your knees and back to compensate. To do the Hip-Flexor Kneeling Lunge, start in a half-kneeling position, with one knee on the floor and the other foot flat in front of you. Now, this is crucial. Gently squeeze the glute muscle on the side of the kneeling leg. This small contraction tilts your pelvis and sends the stretch deep into the hip flexor. Gently rock forward an inch or two until you feel a comfortable pull. Hold for 30 seconds, then switch sides. Do this once a day. You're literally unbinding your hips so your legs can swing freely again. The second move is the Glute Bridge, the powerhouse builder. Your gluteal muscles, your butt muscles, are the true power drivers of your stride. When they're weak, your body pushes the walking load down to your hamstrings and knees, leading to overuse pain. Strengthening the glutes stabilizes the pelvis and takes pressure off the lower joints, giving you that confident, steady gait we all want. Lie on your back, knees bent, feet flat on the floor, about hip-width apart. Gently lift your hips until your body forms a straight line from your shoulders to your knees. Hold for a count of 5, squeezing your glutes at the top, then lower slowly. Aim for 2 sets of 10 to 12 repetitions. This subtle yet powerful move reestablishes the hip-to-leg connection your walk depends on. The third move is the soleus wall stretch, the hidden calf relief. Most people stretch their large outer calf, but they miss the deep soleus muscle. The soleus activates when you bend your knee, and when it's tight, it restricts the natural roll of your foot from heel to toe. That restriction turns a smooth stride into a flat, painful shuffle. Stand facing a wall and place your hands on it. Step 1 foot back, then bend both knees, keeping your back heel firmly on the floor. You should feel the stretch lower down in your heel and Achilles area. Hold for 30 seconds per leg, and do this before and after your daily walk. The fourth move is the standing heel raise, the shock absorber tune-up. As we age, the ability of our lower leg muscles to absorb the impact of walking diminishes, which often leads to knee and ankle pain. The standing heel raise strengthens the calf and shin muscles to restore that vital shock absorption. Stand near a wall or counter for balance. Rise slowly onto the balls of your feet, lifting your heels as high as possible. Pause at the top for a count of 2, then lower your heels slowly. That slow lowering the eccentric phase is the most powerful part. Do 3 sets of 10. Once you've mastered 2-legged raises, try them on a single leg for even greater stability. The fifth move is the ankle alphabet, the mobility lubricant. A stiff ankle is a major liability. When your ankle lacks mobility, your knee is forced to rotate unnaturally to keep you moving, and that puts harmful shear forces on the joint. Sit comfortably in a chair and lift 1 foot off the floor. Use your big toe like a pen and slowly write the full alphabet in the air. Focus on making large, clear letters, moving your ankle through its full range of motion. Repeat with the other foot. 2 minutes of this lubricates every tiny joint in your foot and ankle, translating instantly into a smoother, less jarring step. The sixth move is the seated march, the core connect stabilizer. Walking is fundamentally a balancing act. Your core muscles, not just your abs, but the deep stabilizers of your trunk, must fire to keep you upright with every step. If they're weak, you sway, and your legs overwork to keep you from falling. Sit tall on the edge of a sturdy chair, back straight, feet flat. Tighten your abdominal muscles. Imagine pulling your belly button toward your spine. Slowly lift your right knee toward your chest. Hold for a count of 2, then lower with control. Repeat with the left knee. Don't lean back or let your chest collapse. Aim for 20 total marches. This small but powerful movement trains the exact muscles responsible for walking stability. The 7th and final move is the standing single leg balance, the ultimate fall-proof move. This is the most crucial exercise for pain-free walking. Walking is literally a continuous series of single leg balancing acts. The strength and confidence to stand on one leg, even for a few seconds, directly correlates with walking stability, reduced hip pain, and fewer falls. Stand behind a sturdy chair or counter. Lift one foot just a few inches off the floor. Don't lean on the counter, use your fingers lightly, ready to grab only if you sway. Hold this position, using your hip and core to stabilize, for 30 seconds on each leg. Practice while waiting for your coffee to brew or brushing your teeth. As you improve, try letting go of the counter for just a few seconds. These 7 simple daily moves are not a temporary fix, they're a long-term commitment to self-sovereignty. They represent a profound shift in perspective, from enduring pain to proactively engineering comfort. By giving just 10 minutes each day to these muscles, you stop treating symptoms and start fixing the root cause: instability and stiffness in your hips, core, and ankles. The goal isn't just to walk, but to walk with joy, with confidence, and with the kind of powerful, pain-free stride that lets you fully engage in the life you've worked so hard to build. Your next steps are waiting. Don't let another day pass where the fear of pain dictates your movement. Start with just one of these moves today, the Hip-Flexor Lunge, and feel the immediate difference. If you're truly ready to transform your quality of life, hit that subscribe button, because what's coming next could change the way you move, think, and live.